All right, so our next speaker is Dr. Sky Blue. Dr. Sky Blue is an infectious disease specialist who has served Idaho patients for 25 years. After completing his medical training at the University of Iowa and residency in Phoenix, he pursued fellowships in infectious disease and medical informatics at the University of Utah. Since coming to Boise in 1997, he has built a distinguished career combining clinical care, research, and medical leadership. In addition to his current role as a medical director of antimicrobial stewardship and infectious prevention at St. Luke's Health System, he has served for many years in parallel leadership positions at St. Alphonsus Health System, where he's also chaired the Institutional Review Board overseeing the ethical conduct of clinical research. All right, please help me welcome Dr. Sky Blue.
All right, well, thank you, and I'm going to take us right up to lunch. So let me find where I'm going here. Yep, so I'm going to talk about infections and climate change, which is a pretty big topic, and in fact, I've been talking about emerging infections now for over 20 years too, as one of the other speakers had mentioned. And during that time, the recognition of the association with climate change has only increased. We talked about the Medical Society Consortium, and this was an article that they were associated with and put out. And everybody, when we talk about infections and climate change, has different ways to divide it up. You know, and we talked about these exposure pathways, and I like how they line things up and talked about the different diseases that are associated with each exposure pathway. However, you know, as somebody had said earlier, is I like to get to the heart of the matter, what's behind all of these instead of just pathways and lists. And what I see with infectious disease and all this is kind of three main areas. And I'm going to go through some examples of these as we talk about it. Emergence, expansion, and evolution. And one of the things I also like to do is say, you know, are those symptoms or are those a diagnosis? And I think they're more symptoms of what is really going on, which is really poor planetary health. And we've also talked about in this conference, which I've loved all the speakers, is how do you use talking points to get some of these things across? And I think I like to use this poor planetary health as one of those talking points, which is, you know, what's going on in this Anthropocene epoch. And I love that term, although like Pluto, it got voted down, and now we're officially not the Anthropocene epoch, but it really highlights what I want to talk to. A lot of words on this slide, and we're going to mention a lot of these. Direct health effects, ecosystems that are affected, and these indirect and displaced health effects as well. And I want to highlight something that has been mentioned in some of the other ones, but since we haven't had as much talk on it, is biodiversity loss in all this. The other thing that we have not mentioned as much about is population growth. So we've talked about the climate change, and climate change is real and everybody agrees on that. But what's kind of, and I put this slide together at the Anthropocene epoch, is population growth. We are driving climate change. We're driving the nutrition needs of the planet. And we talked about, you know, how yes, and you know, we also mentioned that there's differentials in power, and we have individuals who are having to produce the food that the Western countries want to eat, which is protein and those sort of things. And we put them in harm's way when they're giving us the protein that we're looking for. These environmental harms come from both our food production in some ways, and also the what we're doing with our cities with population growth, and the biodiversity loss. So if you want to use this as a talking point, say that this planet, and mentioned earlier, we don't have planet B or a plan B, think of this as a person. And so if you're looking at biodiversity loss, that's your microbiome. Somebody can say, but my antibiotics are going to mess up my microbiome. I need, probiotics. When we talk about what is a 2-degree temperature difference for our planet, you try to walk around with a temperature of 102 to 103 degrees all day. It's going to make a difference. When we talk about our water, that's our urinary tract. When we talk about the lungs and the pollution we're doing for that, that's our respiratory tract. So these, and as I go through infections, it's a symptom of poor planetary health. So population growth, and you've seen these slides, and this doubling time. We saw this and I thought that we were going to make this connection when we looked at the carbon going up. It mimics this exponential growth of our population as well. But there is some projections that is saying that the rate of growth is declining, so that we actually may get a plateauing of that effect. And so with that, we have something to plan for. Where we are now, where we're going to be, how can we plan for this planetary health despite what we're seeing in our population growth? And it's not uniform. And we mentioned this before, and I love the mental health that singled out Nigeria. So look at Nigeria, which is this big increasing magenta bar that is really taking off in these population growths. We have India and China, but the Western countries are not seeing the same population growth as some of these other areas. So population is not uniform as well. And so when we're looking at population growth, and I haven't even got to infections yet, it is different for these different populations, right? We're looking at these developing areas and developing countries in India and China, but Middle East, but also in our environment. We're seeing overcrowding in our wild areas. We're seeing mass gatherings. And so we're seeing also those effects of population growth. So bringing it back, we've talked about heat, we've talked about extreme flooding, wildfire, and all those sort of aspects in here. But now let me get into some emerging infections. So it's a symptom of poor planetary health. So emergence of diseases that are new to humans. And Dr. Fauci, co-author of this, is looking at these newly emerging and re-emerging infections. And we go all the way back. HIV is an example of an emerging infection from an animal host to an area of the world that was vulnerable at the time to get that into the population and take it out. One of our very earliest, pandemics as well. And so there's a lot of diseases on this list that are we've heard a lot about. And I've been doing this talk for 20 years, but really thought it would get a lot more play when we started to talk through the pandemic. So during emergence, again, getting at the heart of the matter, what is happening here? So when we're going to see these emerging diseases, they're most likely going to be zoonotic in origin. Bats and rodents are huge reservoirs for these diseases. And they are the heart of Black Death, coronavirus, a lot of these. And they're going to be viruses with an RNA genome. And I'm going to talk about that in a second. They're going to arise in these areas of poverty, high urban density, and at areas where there's climatic and ecosystem disruptions. And we're going to diagnose them now through that DNA RNA sequencing. But there's also these non-viral factors that are affecting this. And we've talked about a lot of these: deforestation, the loss of biodiversity. When these viruses are just happy to be in their animal reservoir, but now we have livestock grazing in those areas. We have fruit bats dropping their half-eaten fruit, where we have swine. Swine, mix with these live animal markets with people and other animals. So this biodiversity loss, and then throw in that global travel. We can get across this globe overnight. So there's a lot of those factors playing a role. So to date myself, this was a talk I gave 20 years ago. This is not our current SARS pandemic. This was in 2003 with the OG SARS. And, we had the same questions back then with that coronavirus. So a small interlude. RNA genomes. And why did I say we're going to see this in emerging infections? Because RNA, when it replicates, is error prone. HIV has 10,000 base pairs. When you're infected with HIV, you can make 10 billion virions a day with an untreated HIV infection. With an RNA genome with 1 in 100,000 errors, you're going to have 100 million errors a day that you're testing out. An error is a mutation that changes a protein, and that can give rise to host switching. DNA genomes, much more careful, and has a much lower error rate, and that's why we're not seeing these DNA viruses as much in this emerging infection environment. Coronavirus, so pulling back to SARS, the spike, you've heard so much about the spike. It has high rates of RNA recombination, and the spike glycoprotein tolerates a lot of mutations in those areas, but it changes the tropism for the tissues. And that's what we're finding. We thought, the original SARS, our public health got us out of that, and we didn't have the pandemic we seen. But we know now that there was changes in the tropism of the tissues that virus was attacked for, as well as its transmissibility. In a nutshell, we didn't transmit that during a large asymptomatic phase, which we did with our current pandemic. So back to that, zoonotic idea, we found this link to civets. And who knew what a civet was way back then, right? But at that time, back to the protein needs, and in this, civet was what's for dinner. And those were the protein wants of the rich and famous in Guangzhou in China. We've also found through that several of those other carnivores had high rates of involvement with the PCR, and we now know that it comes back to a bat as a reservoir of these coronavirus. It's not a lab leak. So, emergence. We're seeing emergence. Zoonotic RNA viruses because of loss of biodiversity and population growth. Let's talk about expansion. Expansion of infectious diseases comes in a couple different flavors as well. First, I want to mention vector-borne diseases, right? So vector-borne diseases have a lot to fit in with climate. They're not really happy that the population is growing and there's more people to bite. Mosquitoes and ticks have different life cycles. Mosquitoes live only for weeks and ticks to 2 to 3 years. So they're on different ecological scale, so to speak. So common tick-borne diseases in the US, a pretty large list that can be affected as these ecological changes going on. And I want to talk about a disease from the black-legged tick, which, as we all know, is Lyme disease. And we mentioned somebody from the Northeast now, already mentioned it. It's, do you let your kids play in the grass? It's part of life in that area with a pretty high population growth. But we're having an increase in favorable habitat with climate change, lengthened transmission season, and our winters are not going to be severe enough that it's going to knock off ticks in the winter. Meanwhile, that picture I saw with the population growth, you have tens of thousands more people out in those same recreation areas. So, walking through what the black-legged tick and Lyme vector is going to look like as we grow right on up until it's really taking over, most of the eastern half of the United States. This is babesiosis, looking at similar tick-borne diseases, increasing in areas with climate change, temperature changes, and ecosystems. So ticks and mosquitoes, arboviruses, Lyme disease is a bacteria, Borrelia, but now with mosquitoes, we're going to get into some arboviruses. Arboviruses just means that they're arthropod-borne viruses, and we have a lot of them. Believe it or not, one of the things we've seen in Idaho was the emergence of West Nile virus, right? Flavivirus. It came across into New York in 1999, and we think because of global travel, expansion of all sorts of things, it probably came over with mosquitoes or birds into New York. And then from there, it pretty much emerged across the United States. If anybody was here during the mid-early 2000s, you'll remember when it kind of hit Idaho. And so if you look at that, and it kind of highlights what we're seeing again with this urban wildlife interface, you see the years where it kind of expanded into the United States, and what had happened is it kind of worked its way down the Atlantic flyway, migration areas, and then up through the Mississippi flyways. And then, throughout the rest of the United States, right? And we saw it really taking off with the birds and the expansion of these mosquito vectors. So I'm going to just pop through this one, just looking at the West Nile cases more recently. So West Nile is a flavivirus. And you guessed it, it's an RNA virus. And we have a lot of other flaviviruses as well to be aware of. Dengue, we've talked about the resurgence of dengue up through the Americas with the push of these. These are mosquitoes that are the Aedes aegypti. Okay? They're the ones that also carry malaria, but dengue, Zika, and yellow fever, right? Where West Nile is a Culex mosquito. They're the ones we have in Idaho. We don't have the Aedes aegypti, but it's moving north. We're seeing dengue in Texas, in areas of this southern United States now. And we have a closely related mosquito, the Aedes albopictus, which can now start to carry some of these infections as well. Zika, yellow fever, dengue, and these are the Culex transmitted flaviviruses, West Nile, Japanese encephalitis virus. And as these start to mix and you get that host switching, we can see these diseases reemerging or expanding into areas we have not seen them before. So these are the flaviviruses to know about. Paswassan virus is a tick-borne flavivirus that is invading the northeast as well. So the tick-borne West Nile is kind of what its symptoms are like. So as we're seeing through all that, mosquitoes and vector-borne diseases are pushing up in here. But we talked about climate change, and what the other things that's doing to lead to poor planetary health. And we're starting to see tropical and temperate areas shift. Whereas temperate now is further and further north with the loss of the ice and the greening of our northern and southern areas, and the vegetation changes. We have fires, we have other things that in that. Wildlife migrate during that period of time. Vectors change their range and density, and it affects our human activity as well. We had an article by Dr. Fauci, and this is one, Jared Diamond, Guns, Germs, and Steel, way back from 1997, looking how some of these things, change human societies. Crowd diseases are higher in temperate, measles, right? They tend to give you long-lasting immunity. Whereas in the tropics, which are now moving north, are more those animal reservoirs and vector-borne processes. So with temperature, let's see how that affects. And water-related illnesses, as we talked about, those exposure pathways, come from a lot of different places. Livestock runoff that gives us cryptosporidium in the water, and around Milwaukee, we've seen a lot of those different things with algal blooms and other effects. But let me talk about the expansion that occurs more specifically with temperatures. So this is more recent from a New England Journal article on Vibrio vulnificus. So this isn't an RNA virus, it's just a bacteria doing what bacteria like to do, which is live in warm, brackish water, right? So when we had floods down in Florida, and you can imagine diabetics with their, cracking and diabetic feet and breaks in the skin, now wading through floodwaters in that area. They're going to be exposed to this bacterium that loves that warm, brackish water. And we see big skin and soft tissue infections with that. It can be life-threatening as well. So if you watch what happens as temperatures change, especially in our oceans, the increasing Vibrio vulnificus infections just kind of keep tracking north, right? You see this all the way up into the very high populated areas around Long Island, Connecticut, and the Northeast. Chesapeake Bay, where we get a lot of our seafood. Look at the density and that changes with your summer. So summer in the next 20-25 years, the Vibrio concentrations in the Chesapeake Bay are going to be very substantial. Small cuts while fishing in those areas can lead to significant health issues. So expansion, not only vectors, but due to climate change as well. So let me finish up with the third why, which is kind of the evolution of this. And I talked about some of the evolution changes with these RNA viruses as well, but infectious agents with new disease potential. So Candida auris. Nightmares for hospital systems, right? It's the new multi-drug resistant organism that can shut down ICUs and hospitals. First described in 2009, first time. Since then, we've had a rapid emergence worldwide. We think it almost developed simultaneously in different parts of the world around that same time. First reported in the US in 2013, and really is effective colonizer of skin, survives on equipment. It's actually heat, salt, and disinfectant tolerant, forms biofilms, and is resistant to a lot of our antifungal therapy. And that's really a perfect storm for our nosocomial infections and hospital issues. classified as an urgent threat. So how did it arise? So a lot of speculation, but what we tend to think of is that it was an organism that we could trace back to being on aquatic wildlife. And as those areas, and one of the things that's been a barrier to humans getting a lot of fungal infections, unless you watch The Last of Us, is that our body temperature tends to be a barrier for some of these fungal infections to infect us. However, if you see this slow warming of our oceans where we have these organisms, to survive, they're going to evolve to be much more tolerant at higher temperatures. And so with that, we think this Canada auris as a species of yeast was able to evolve during that warming area and colonize aquatic mammals and get into people. That same gene that is responsible for that increased tolerance to heat is also one of the genes that gives it much more likely to develop this antifungal resistance. So then we have the vectors and birds that could take it worldwide, and we have that population growth and all of that. So all of these things are coming together. So Canada auris quickly became a global threat as well. Avian influenza, we're seeing that. This pulls together the emergence, the expansion, and the evolution. And with what we're seeing this now in cattle, the mammary glands of cattle have the same receptors that birds use for all that. So we're seeing that spill over into domestic cattle and humans and pets. So we're seeing the number of dairy herds, poultry, although only a few human cases for now. Migratory spread with the birds also. So then want to finish up with a few of these, like we all have, of what we can do. And first I want to start with what science can do. Right? What can we do on the emerging infection front? One, we can be aware that these are going to happen. There are going to be RNA viruses in areas of these urban wildlife interfaces with a lot of vulnerable individuals. We can look for those pathogens in that area. Early outbreak detection, both in wildlife, domestic animals, and people. And we can start looking at the ability to find this RNA, DNA sequencing, molecular diagnostic testing, new antiviral treatments, and international public health infrastructure. But what is being shot down right now is exactly those aspects. So we've talked about people on the bubble, species on the bubble, right? The areas. If you want to look for emerging infections in these areas, this is the guy you want to be aware of, right? Exactly at the intersection of those areas. We've also had, next slide, my next slide, well, there we go. We actually had USAID working on this aspect, right? So another RIP program that was setting up in these areas of hotspots that are going to be our next pandemic, looking for those areas, that are going to be that Central Africa, those high population areas where we have a lot of subsistence farming. I'm getting my time frame coming up in there. Hotspots for emergence, and then what can we do? I'm leaving out healthcare for a second because I know we have some breakouts looking at that, but there's a lot of things we can do in healthcare. Work with our pharmacy team on antimicrobial stewardship. We work with infection prevention on our isolation areas, but everybody in medicine who prevents diseases, can reduce our carbon footprint in that. Individuals in general, we talked about this. Talk about it. Think globally, but act locally. What can you do in your neighborhoods, in your family, in your systems? Conservation, stop deforestation, habitat loss, biodiversity. It's a symptom of planetary health. Wise food choices. What can we do, for ourselves and our families, and income inequality is a symptom of poor planetary health that has been mentioned as well. So the last couple slides, Rockefeller Foundation has been looking at this for a while. They have resources on all of those things also, and I think that is probably, at least, if not my last slide, the last one of much import. So at that point, I think I'm about on time and happy to entertain questions, or I can be around in the break if we want to get moving as well.
Question for you, Sky. Is wastewater sampling more effective than trying to identify patients and doing patient testing for outbreaks? And if so, are we doing these broader RNA virus samplings of wastewater samples, or are we waiting until we see new disease emerge in human patients to really start testing for things?
Yeah, so question on wastewater testing. So wastewater testing has been a recent development as far as public health goes and infectious diseases as well. And I think it's been a very valuable data source. And what we don't know, however, is the correlation. So when we see a wastewater level that is increasing, what does that mean for public health? What level do we start to, recommend, different mitigation factors and those sort of things? When there is funding, it's a great resource for looking at some of these emerging infections. Identifying polio, right? The reemergence of vaccine strain polio in certain jurisdictions, because you only have disease in 1 in 200, 1 in 2,000 of the individuals who are infected. But if you're identifying it in the wastewater, you can say that we're going to see those infections in humans. We're looking at it for a lot of the diseases that are epidemic. When does the season start? When is the season ending? And the metagenomic ability now with our supercomputing, which is its own carbon footprint and an issue, right? But, what we do is we feed in all the DNA snippets that we find, and then we run them through these huge libraries and say, this is what it matches to, and we can come up with some other things that we're seeing in wastewater. So when the funding is there and used in the areas, it can be a huge ability to identify something that's new to the area. We've been looking for Candida auris in our wastewater, in these areas. Is it around, even though we're not seeing it in clinically? So, but it's something that we're learning with and really need the funding to keep that going and study that.
Thanks, Dr. Blue, for the talk. That was excellent. My question is, these are very complex things, I think, even if you have a medical background to understand. So when you're doing your outpatient visit and you got 30 minutes for that follow-up, how do you bring this all together to explain to the patient how climate change and these emerging new diseases is adversely affecting their health, or could adversely affect their health?
Yeah, great question. Is start where we started the very first talk with, is how do we talk about this, right? And you really have to meet the individual where they are. have had a lot of these hard conversations around vaccinations, during this period of time as well. And so depending on what I want to get across, and when I have a patient in front of me, although I want them to be a climate advocate and think like I think, that's not my goal at that point per se, because I have a patient with me. And so I meet them where they're at. And as we negotiate how we can get them where they want to go, I often lead with what questions you have, or what can I tell you that'll help you make the decisions that we're trying to make here together, that shared decision making. Because the saying that you can't use facts to argue somebody out of a position they didn't use facts to get into. I don't want to create an argument when I'm on their side. And so, it really is meet them where they're at, find out what they're looking at. And in Idaho, a lot of it comes around to, farming, our environments, passions like skiing and things like that we're talking about. When it really comes to infections, I like to use that body analogy. And because I have almost everybody say, well, what's that going to do to my microbiome, right? And we can talk about biodiversity. When we talk about temperature, and you can relate to that, how do they feel when they have a fever? There was a question earlier about how long do we see the climate effects of wildfire smoke and things like that. In Utah, I also did research and was a part of the geriatrics division. And we talk a lot about the effects of different things on the human body. And when we hit adolescence for lung capacity, an analogy that you're used to, is kind of at our maximum lung capacity. Off of that, we lose about a shot glass of lung function each year. So our lung function is slowly going down. When we see, we have a climate crisis, and we have particulate exposure, and we actually have damage to our lungs, that's a decline that we have acutely, but we still continue to lose that shot glass of lung function each year. So you have that effects, but if you're young and healthy, you might not notice that, but you're going to get to the point of disability at an earlier age than you would have without that effects. So you may not feel that, you might not feel that it pulls off your personal best at your next 5K, but you may be more likely to need oxygen at a time frame earlier than you would have otherwise. So, depending on what I'm trying to get across, those different analogies with all that, and what is important to them, I think, can bring it back home.
It's Breck Lebag from Washington State. Thanks for the talk. Surveillance systems have to be quick and nimble to be effective to head off disease. Could you talk a little bit about the funding cuts effect on the lag time of identifying new disease emergence? Thanks.
Yeah, so great question. To be effective, I think you have to have that surveillance system that is responsive and agile and can get that, which is a huge issue. And we've seen that, and in fact, the people in this room have to be, part of that. Because we see small clusters, whether it's a backyard flock of chickens that have an issue that you're seeing, or even a family cluster for a family physician who's seen a disease or a group of diseases that is not really explained. So we have to use everybody in that crowdsourcing to be able to replicate some of the specific systems that I think you're talking about that require significant funding and the platforms that can look at the scat from primates in Central Africa to look at diseases that were not recognized, or can go into, bad and caves and pick out guano to look at viruses and those sequences to understand how those might affect the human health. And can't understate the lack of funding, and in my opinion, the short-sightedness of not looking and thinking globally and trying to just build a wall around, literally and figuratively, around the United States, because our lungs are the Amazon. So when we deforest, and that's our biodiversity of our microbiome, that affects the rainfall in Kansas. So we're a global, we're talking planetary health here. And we can't ignore an infection in your thumb just because we're concentrating on our right foot. So point well taken, and thank you for bringing that up. But with lack of that, turn to all of us to be that early warning system.
Effects of vaccines on the emerging diseases, i.e. malaria vaccine, which is now being given to a significant portion of infants in high-risk countries like Africa and India, and chimichanga, which I can't even pronounce, which it's also expanding. And just today, just yesterday, they were talking about the fact that the vaccine that they came up with is now not going to be available to the elderly, who are the most neurologically affected by chimichanga. And so what do you have to say about any of that, the vaccine in terms of these emerging parasites because of climate change?
Right. And so, again, what can we do? One is you want to address the underlying problem, which is our planetary health, right? But in the meantime, remember the slide I said of where we're going to peak in our population? We're going to peak, we're going to get there, and we have to decide how we're going to make it to the other side in this planet, right? So at the same time, we have to mitigate the effects of what we're seeing. And so as we identify, emerging viruses and viral vectors, and we talked about how we're going to identify those by RNA, DNA sequencing, we're starting to look at the platforms through mRNA vaccines that allow us to rapidly get some of those sequences to vaccines. So as we start to look at all this, and we talked about the crowding in the population areas and how we're going to be ripe for these new diseases in these high population areas that are going to lead to a lot of suffering unless we can get to the prevention. So that's where we want to all do our part in our food choices, the rest of that. But what can science do? We can start looking at those platforms that can get vaccines to large groups of areas to prevent the widespread potentials for pandemics and suffering, while we're all working together to get up to the hump and work on our planetary health. So thanks for that question. And chikungunya is a very important, virus that is a vector-borne, mosquito-borne as well. Not a flavivirus, though, but one of the same family. Okay.